Welcome to Podcast UK.
In this episode, we look at mindfulness and how it can help us as surgeons. No, don't switch it off. Listening to this episode may literally change your life for the better.
Hi, my name is Martha de la Cruz Monroy, and I am a plastic surgery trainee from the Yorkshire Deanery. And on this episode, we have a somewhat different but not less important session. We will talk about the practice of mindfulness and how this can benefit us as surgeons. We will also include a guided meditation mini session to give you a flavor of the practice of mindfulness, as well as some tips so that by the end of this podcast, you can start incorporating mindfulness practices in your life. Our special guest today is Dr. Poonam Bagga. Dr. Bagga is a retired ophthalmic surgeon who's now working full-time as an executive and life coach. I met Dr. Bagga last year when she became my coach as part of the Health Education England Support Her Return to Training program following a year of maternity leave. During our sessions, she introduced me to the practice of mindfulness and gave me a number of techniques, which I then incorporated into my life. And all of her teaching has been incredibly valuable, particularly at times of very high stress. Welcome, Dr. Bagga. Welcome to Pod Plus UK. Thank you. How would you describe the practice of mindfulness to someone who is completely new to it?
So that's really an interesting question. You know, it's such a bandied around buzzword right now, and everybody talks about mindfulness in school education, mindfulness in admin teams. But what it really means is to be aware in each moment. So as things are now, just looking at them as they are, facts, no stories, no embellishments, in this moment, and looking at them without judgment and with acceptance. Now, those are hard attitudes to bring because as medics and as human beings, really, we are conditioned to making judgments. We like things to go our way. And when they don't, that's where we either get angry or we get resentful. We don't feel happy. So mindfulness essentially is a practice where we bring awareness of this moment as it is without judgment and with deep acceptance.
So I suppose it's trying to live the moment and try to leave those emotions that arise from judging what is happening, try to leave those emotions behind.
We don't leave the emotions behind. So if any living being perceives a threat, the first reaction is to survive. How do we improve survival? And that's all we are wired for. At work, when we are trainees, we are facing a lot of challenges, like we feel that we are being judged by our seniors, we are being judged by patients, and actually we ourselves are judging our performance as well. So there's a lot of stuff going on altogether, a lot of judgment in that. And the human organism feels threatened by that. And whenever we feel threatened, it's our sympathetic reaction that comes in. What mindfulness teaches us is to observe that reaction in the body, in the mind, with awareness, and then bringing certain attitudes into that observation. One is objectivity. And objectivity is, am I giving it a positive or a negative value? Say, I am operating and I want the incision to be a certain way. And then I think, oh, it hasn't happened exactly as I wanted it. This is really bad. Now, that is a judgment that this incision is bad. If I just pause and think, this is an incision, do I need to do something different? It's neither good nor bad. What would be better for the patient outcome? When I'm stopping the judgment, I am not allowing my subconscious mind to go into reactivity. Because as soon as I say it's bad, my subconscious perceives that as a physiological threat. And with sympathetic overactivity, I will go into survive mode, threat, run, fight. So it's fight or flight. Whereas if I say, oh, you know what, let me have a think. What can I do to make it exactly as I would want it to be? So we are not judging. We are allowing our cognitive brain, our frontal precortex, to think Whereas when we are in a threat mode, precortex, the frontal lobe, isn't getting enough blood to think. So when we stay calm, we think better, we perform better, we have better memory of the past events of all our learning. So that's how it applies to surgeons.
That's great. That's really, really interesting to point out what we tend to do when something doesn't go quite as perfect as we want it sometimes.
Yeah,
We just
yeah,
react rather than respond.
yeah. And also, it's like, it's not just our self judgment. It's also we are worrying about, oh, what will the nurses think? What will my senior think? So we are bringing in all that as well. And we are worrying about their judgment. Whereas if we pause and think, okay, how am I going to handle this to the best of my ability, rather than making a judgment about good or bad?
Okay. No, that's great. What specific technique you could suggest?
Before I come to the techniques, Martha, there's just one thing I would like to mention, that there are lots and lots of studies which show a very high burnout rate amongst doctors, especially trainees. At all stages of our career, we are having a work-life balance juggle. Especially when we are young, we are trainees, we want to learn a lot. There are long duty hours. We have young children at home. Our spouses are in busy jobs. So it's such a challenge to meet all those needs. It is bringing that awareness. There's a very interesting paper in 2025. It's come out of Toronto. It talks about burnout amongst plastic surgeons in particular. So you might want to have a look at that one. And it's essentially the same figures that are quoted for other surgical specialties as well. Surgeons by nature, and I think actually medics by nature, are perfectionists. We want very good outcomes for our patients. And quite often, even if we ourselves are pretty okay, we still think, oh, my colleague is doing better than me. They know more than me. We are comparing ourselves to other people. And sometimes it's not positive comparison. So it's bringing that to our awareness. I have noticed this, especially for trainees who are coming back from maternity leave. It happened to me when I returned from maternity leave. You've been away for 9 months and you've been through a life-changing event. And when you come back as a surgeon, the expectation is that we'll perform as before. When that doesn't happen, it's such a shock to the system. It's having that preparedness to accept that it will take time. And it's not just for people who return after maternity leave. It could be people who are coming back after sickness, after another break for family reasons. If you haven't been operating day in, day out, you are going to be a bit rusty. So bringing in compassion and understanding for yourself, but also having the conversations with the team ahead of time, rather than going ahead in and then worrying about it. So that, yes, we will be a bit rusty. We will need more support whilst we are returning to the previous level. So, Martha, you were asking me about the techniques. First is awareness. Until we are aware of a problem, we will not seek a solution. If we keep burying the issue of burnout and say, oh, it's just me, I need to do more, I need to do better, then we are actually not looking at a solution. We are just pounding ourselves heavier. First of all, it's having that awareness, asking the question, am I doing the very best that I can? And if the answer to that is in affirmative, then it really is time to seek help. Talk to people about it, because the chances are others have been through it or are simultaneously facing the same issues. There are certain attitudes to be cultivated. One is the ability to look at each event as it is unfolding and really describing it in non-judgmental ways. So not saying this is good, this is bad, just saying this is what is happening. So keeping it quite factual and objective. Once you've asked that question, am I doing the very best I can? Then bringing in compassion. Okay, I'm doing the very best and I'm still not succeeding. Why is that? Rather than being critical. So there is a very often quoted sentence, which is, you cannot pour from an empty cup. So if I am feeling really burnt out and I'm not able to bring in any compassion to myself, the chances are that when I have patient interactions, colleague interactions, interactions at home with spouses and children, they won't go well either, because the energy is so low. Because if I can't be compassionate to myself, understand my own needs, how am I going to extend that courtesy to others? And that then either brings irritation, anger, further judgment, depression, anxiety, all those with it. So it's cultivating awareness of how I'm feeling and how am I going to change what is not working. But the change can only be implemented if we are ready, if we have the desire. So it is awareness, desire to identify what needs changing, accepting what is happening, and then taking action once that assessment has taken place. And our thoughts are very powerful. Our mind weaves stories based on previous experience. For example, I've had a patient on the table and I've had a complication during surgery. Now, when I see another patient who's a similar operation, then I'm already sometimes going in with fear rather than thinking, okay, that happened that time. What did I learn from it? How am I going to be more aware of what can happen? So if we are thinking it through, then we can control the fear. But if we are going in with that as our major emotion, then we are already in threat survive mode. We are not in the thrive mode. Thrive mode is where we can think more clearly, we can make better cognitive plans, we can execute the steps more effectively. So it's really looking at, okay, how am I going into this surgery? How prepared am I? Am I going in with curiosity or am I going in with fear?
Yes, I see how all of this can help us as surgeons, as doctors, when dealing with potentially uncertain outcomes or high stakes decision making, which can be an everyday thing. And I imagine because we chose this career, we thrive as well on a certain level of stress. So we do like this. When things get a little bit too much, this when taking that tiny step back can help us.
So there's good stress and there's bad stress. And good stress is like, we're going into an operation and we are excited. Oh, we're going to help a patient. But bad stress is, oh, I'm not as good as the other person. What will happen? Or this didn't go right last time. What if it happens again? So it's that story that we are beginning to weave. Instead of that, if we are aware, okay, we are going in for this operation. These are the steps. This is what happened last time. And what did I learn from it? How am I going to implement that learning now? Incorporate it into my skill set. So that's active thinking, but there's no judgment in that thinking. Surgeons by nature, we are process driven. We learn a procedure, we look at the steps, we practice them more and more, we get better. Our control comes from our knowledge. But when something happens that is a complication, that moment becomes stressful. And as we go up the ladder, it becomes less and less stressful because we know how to deal with that complication. But some people will still carry a lot of judgment. So it is learning quite early on how to get the best outcomes. So the technique involves, like I said, there are certain steps, attitudes, attitude of awareness, attitude of desire to learn and desire to change, attitude of compassion, non-judgment, acceptance, and observation. So I'm going in for surgery. I observe what I'm feeling inside. I also observe what I'm thinking. If I have observation of my thoughts, I can manage the thoughts, but otherwise the thoughts are a loop. Literally, if you're driving from home to work, you may reach there and think, oh, I don't know what happened on the way, because we've been so busy in our thoughts, we didn't even pay attention to how we reached from A to B. It is paying attention in this moment. And that is every moment, learning to pay attention. And it's not an easy skill. It's a really difficult skill. And it takes some time and it takes commitment. And that's why not many people do it, because they think it's difficult and I don't have the time to do it. But if you make a commitment, and it doesn't need to be difficult, because you only need to do it for maybe 3 to 4 minutes a day. So if you set an intention every day in the morning, I'll do mindfulness for 30 seconds, 5 times a day. And there are many different ways. You can focus on your breath, you can focus on a sound, you can focus on your thoughts. Quite often, breath is easy because it's a physical entity. and it's with you at all times. And also, your breath is linked to your sympathetic system and parasympathetic. So when we are stimulated or triggered and our sympathetic is going into an overdrive, our breathing is faster, our heart rate is faster. If we look at it, we will notice that we are not able to think so much because we are in the flight or fight mode. So the brain's making us ready to run. So our thinking is not as cognitive, not as planned, because we are trying to survive. Now, if we pay attention to the breath just for 30 seconds, I'll do that practice in a few minutes, then as we begin to focus, our diaphragm moves, takes longer excursions and stimulates the vagal nerves and kicks in the parasympathetic to balance the sympathetic. With mindfulness, we are doing it with intention. And when we first start the practice, the reason I said don't do it for longer than 30 seconds, because when you first start the practice, you will realize that literally after 2 breaths, your mind's gone somewhere. And when you realize that, you bring it back to the breath and start with 2 or 3 breaths a few times a day. And then it becomes an integral practice, but it's also whether you want to spend that time. Because a lot of surgeons will say, oh no, I cope really well, I don't need to do it. It's only when they start to do it, they will realize the benefits.
So you mentioned we can do it about 3 times a day. So
Yeah.
just anytime.
Anytime. What I say to the trainees when I'm doing coaching with them is, when you're going from one ward to the other, you are going up the stairs to go to your office or somewhere, anywhere. You literally, if you're going to focus on 3 breaths, that's a very short time. But initially, literally after the first or second breath, the mind will be gone. And what we say is, we don't tell the ocean to stop making the waves because that's not going to happen, but we can surf those waves. So it's the same with the mind. It's the function of the mind, the brain, is to produce thoughts. And if we watch our thoughts, we'll see that literally there's a loop and we sometimes don't even connect. And if I asked you after 5 minutes, what were you thinking? You may not remember the first thought because it's an unaware, unconscious process. And similarly, our breath is unconscious most of the times until we bring it into our awareness. But when we begin to breathe with awareness, it kicks in the parasympathetic and balances the sympathetic.
So breathing techniques are probably one of the most common ones.
It's the common, yeah. For most people, it works really well. There are some people who don't like to focus on their breath. They can choose a sound. But for me, after looking at many different techniques, I came to the breath because I realized my breath is always with me. I'm not dependent on an app. I'm not dependent on anyone else's voice. So that worked the best for me. Literally, it's there all the time. And in addition to that, even with the sound, it will happen. It calms you quicker because of the diaphragm stimulating the vagal nerves.
That's great. If we were to choose a sound, how would that work?
Well, you could either have an app and then you can listen to somebody, or you could choose any, musical note and you could listen to that. You could listen to the silence that's around you. So you can choose any sound. But some people will chant like, what they call a mantra.
What kind of mantra?
So, it depends on people's religious faiths. Some people will say Om, or those who are of a different faith might choose a different word, which sits well with them. But it's literally just choosing any one word and listening to the sound of that. I mean, music is very healing. Music does it really well. It's a state of flow. People who are musicians know that state of flow. They could be playing something on the piano and there's so much with it that they forget the world around them. So it's that state where you feel at ease inside yourself. So that's another thing, recognizing whether we are feeling at ease or is it a state of turmoil. Say if I'm operating or if I'm seeing a challenging patient, if I look within, I will have some degree of unease. And if I recognize that and bring my breath, then I will notice that change within my system. And what that also does, not only does it change for you, it changes it for the person you are having the interaction with. Because when you are beginning to feel easy in yourself, the interaction with the other becomes more smooth. So that will transfer to your patients as well.
This is also so important, really. because if it transfers to all of our interactions, not only patients, but also at home or loved ones, if we have a good time at work, it will translate into good time at home and vice versa. So all of this is so, so important. Just thinking about a different technique as well. I remember in one of our sessions, we did something like a body scan. Could you tell me a bit more about?
Body scan is very, very interesting. So body scan is a technique where you actually start to look at your body. You can start either from your toes and go upwards, or you can start from your scalp and come downwards. And there are lots and lots of body scans on the internet. One of the best ones that I like is by John Kabat-Zinn. John Kabat-Zinn is actually the person who brought mindfulness to the medical world. He had spent some time with the Zen monks and returned to Harvard as a microbiologist in 1979. So what you do is you sit down. You can do it. Once you get good at it, you can even do it walking. You sit down and you start to breathe in and out, and you take the breath, say, to your left big toe. So you feel the breath flow into the left big toe, and at that particular time, you're focusing your awareness only on whatever is the sensation that's unfolding in the big toe. And it may be nothing. It may be a tingling. It may be a feeling of warmth, whatever it is. So you're not judging. You're just noticing, just observing. And you're not giving it any value. You're not saying this is good, this is bad. This is what it is. Then you take your breath to the second toe, third toe, fourth toe, fifth toe, and then slowly you move upwards. But that takes a longer time. So when you are doing a body scan, you come to your chest and you feel, what is it that's unfolding in my chest? And when we are anxious, some of us have a tight chest. We might have hunched shoulders. We might have a, really tight neck. And most of the times we just live with these things without noticing them. But when we do a body scan, we begin to observe these things. And then the technique teaches us to breathe into these parts, and you notice the change that happens. So body scans are a really powerful technique, but it is time consuming.
Oh, and how long would it take for
So
someone
it depends.
to start?
If we do a quick one, it'll probably take about 7 minutes. Whereas if you do a really quick breath, it can be just 2 or 3 breaths, which is what is really good to learn at work, because you may not have the 6 minutes, 7 minutes, but you can definitely do 3 breaths or 4 breaths.
I know you previously mentioned about setting an intention.
Very important, because if we don't set an intention, then we just think about it and it doesn't get executed. So remembering to set an intention starts the ball rolling. And then it is finding out what works for you as to how to set the intention and how to remember it. So our neural pathways are already established in a certain way. And it is said that neurons which fire together wire together. So they're already set in our conditioned reactions. If we are wanting to change something, we have to now start making new pathways. And that is not going to happen without a whole lot of practice. And practice starts with intention. Unless I decide I'm going to do it and I set a time for it and I then implement that, it's never going to happen.
So this setting the intention could be about anything, right? Could be I set an intention about doing 30 seconds meditation each morning, or set an intention to respond that rather than to react to a potential complication, or just like a daily intention. Is that a way to do it?
It has to be a daily intention. Like if it's a short intention, you'll have to do it more times. When you first start doing it, it'll be only a few neurons that will get fired. The more you do it, the more neurons join that pathway. So the way I used to explain it to some of the trainees is, you set an intention that you're going to walk a certain path on a patch of grass every day. When you first start to walk, it's all green and there is no path. But after a week, some of the grass, if you're sticking to the same path day after day, some of the grass will go missing. You do that path 6 weeks, a lot of the grass will be missing. You do that path for 6 months, it'll be a properly entrenched pathway with no grass over there because you're treading it day after day after day. So if you're going to change something, you have to make a commitment to yourself. And the benefits you reap are immense. It changes not just your life, it changes the life of people you're interacting with. It makes it far more fulfilling. When I first started the journey, I had set an intention that I'll be peaceful in the operating theater because when there's a complication, one is anxious and your tone changes, and then you're passing those orders to the nurses. And because the environment has changed, they are also stressed. So if they're looking for something and you're continually harassing them, their productivity goes down. So my intention was I'll be really calm and peaceful with them. I had set an alarm which would go every hour during my theater time. And if my tone had changed, then I might not notice it then. But when the alarm went, I thought, oh, that was for staying calm. And I wasn't calm then. And it gradually came into my awareness how often I could lose patience.
That is so interesting. And I think that is so, so important.
And also for the patient, because when you're calm, your brain thinks better. It makes better decisions. And all that learning that you have stays with you, and your movements are much more precise. There are studies which show that people who start to practice mindfulness, their microsurgical skills get better. It's only emerging evidence, but there is evidence.
Yes, and I had also seen some studies that they show the practice of mindfulness increases cognitive function, efficiency, as you mentioned, resilience as well. And I do know that other careers with high stressful environments like pilots or firemen do incorporate into their training.
And that acceptance, so you said resilience. So one thing is about acceptance, and acceptance is, say a complication happens. There are two ways. One is going into a reactive mode and trying to do the best in that moment. The other is to go into a responsive mode. Just sit back and see, okay, this is what has happened. I have seen this before, or maybe I haven't seen this before, but I know the anatomy. I know the basic steps of repair. What am I going to do in this moment that will give the best outcome to the patient? But if I'm reactive, then there may be far too many movements and far too many thoughts and not enough concentration. So it's bringing responsiveness to any situation. I'm talking of a surgical situation because I'm talking to a group of surgeons, but this could be any situation. This could be a patient in A&E. This could be a situation at home. We react from a place of threat and fear to the system. We respond from a place of understanding and observation and neutrality.
This is so useful. Could I ask you about another technique that I have read about, the visualization method?
Oh, the visualization. So for surgeons, that's actually very useful, but it varies from person to person because some people are visual learners, some are audio learners, some are kinesthetic learners. So for some, visualization will be very easy. Others may have to spend more time learning it. But for surgeons, it's definitely really beneficial to think through or visualize the steps of the procedure that you're going to perform, even as you're scrubbing up. So rather than worrying about some outcome, if you visualize the steps that you're going to be performing, then your brain has already gone through the procedure once. So there are studies that have been done by neurosurgeons, neurologists. They conducted an experiment on piano players, and they gave them the same piece of music. 5 of them only moved their fingers in the air, and the other cohort actually played the same piece on a piano. And they looked at the blood flow, and it was exactly the same. So the first lot were not playing a real piano, they were actually only visualizing. So every time you are going into an operation and you have visualized the steps, or at least thought about the steps ahead of time, because not everybody is a visual learner, so they may not be able to visualize them. They may only be able to think of them. Then those neurons are already aware of the steps. So when you now go to do it, it's not your first time. So that is a really good way of doing things.
That is such a useful tip. Thank you. Whenever I've tried it, I think it has helped me a lot. Sometimes we have a lot of interferences when scrubbing or just before beginning a procedure, so it can be a little bit tricky.
Like I said, you find your moments. If you think, okay, the operating theater is going to be busy, nurses are going to be asking questions, and do it on your journey. You know your operating list ahead of time. These are the procedures I'm doing today. I'm going to think about it as I'm driving or as I'm walking to the hospital. And you've done it. So it's how you utilize the moments.
That's great. No, thank you. So now that we've got quite a few techniques and we have said that without setting the intention of being consistent, it can be tricky. Have you got any advice on how to stay consistent with all the mindfulness?
Either set an alarm or have a message for yourself on the fridge or on a notice board that I'm going to do this. But when I first started, I set an alarm because I had a particular tune and I knew that tune was associated to my reminder for mindfulness. But not everybody likes it. When people are very busy, they don't like that interruption, in which case you set an intention first thing in the morning and do it in the morning. And it gets easier and easier. Once you've done it for about 2-3 weeks, it gets a lot easier. The first few weeks are the hardest. And also by the time you're in week 3, you're beginning to see changes. And then it's very rewarding and people stay with it because they're already seeing the change. I was running a mindfulness session, a 6-week session for some people. And sister from cardiology ward, at the end of week 3, she said, I've stopped drinking coffee. And I was like, why is that? She said, I used to drink 12 to 13 cups a day, but I realized that I was only doing it to have a break. I don't actually even like the taste of coffee. That was a lifelong habit, which she changed in only 3 weeks. It is beneficial provided you stick with it for at least a few weeks.
What would you suggest at times of particular high stress? Is there anything to sort of top up this mindfulness, or do we just do more breathing exercises?
It is bringing awareness of your needs. So if something is very stressful, it's in your awareness without judgment. Say something's happened at home and people don't want to share it because they're very private. Then they're not wanting to talk about it at work. And other people at work may not know what's going on. And if they're not aware of what's going on, they cannot extend a helping hand. If I'm a very private person and I think, oh, I can't share this with anybody, then I need to be curious about why. Why can I not share this stress? And if I still feel, oh, I can't share it with anyone, then at least talk to HR because they will be able to put things into place to give some relief. But it's really important to have that compassion, that kindness to meet one's own needs rather than be critical of that need, rather than think, oh, this is a weakness and I can't show up at work because of this. If I'm stressed for whatever reason, my system is feeling really a level of burnout and I come to work, I'm not going to give my best. So I'm not doing anybody any favors. If my outcome is less than optimal, it may have repercussions for the patients and for the rest of the team, for the department. So it's acknowledging that there will be times when we need help and we shouldn't be ashamed to ask. So that is called accepting vulnerability. Allowing myself to accept my vulnerability and not be ashamed of it. I'm just accepting it, that it's not good, it's not bad. It is what it is in this moment. What is the best for my team, for my patients, and for me? Because if I can get a little bit of relief, then I don't need to be putting myself in a stress situation all the time. And that stress transfers to the team, it transfers to the patients, and nobody benefits. So, in fact, the word is befriending your vulnerability rather than thinking it's an enemy. So how would that work? That's about exploring. How do you learn to befriend your shadows? Because when we learn to be accepting of what we think are our weaknesses, they are actually areas of development. Because once I become aware, oh, this is something I can change, I don't have to be ashamed of it. I can just think, how am I going to change? I might need help, but I can change. And that improves relationships. It improves my relationship with myself. It improves relationships outside of self. Because as you begin to feel happier with yourself, that will ripple out.
Thank you. That's great. That's so interesting. I wonder if you were ready to go ahead with our mini session.
Meditation.
If that's
Yeah.
okay.
Do you want to do a body scan or
Yeah,
just
we
the
can
breath?
try.
Okay, let's do the breath for those people who will struggle with a longer attention span, and then I can do a short body scan.
That's great. Thank you.
Okay. So the breath, just like 3 or 4 breaths. What I would say is start with 2 breaths. And when you have mastered 2 breaths, like your mind isn't wandering off after 2 breaths, then try 3 and then 4 and then 5. And if you've come up to 7, you're doing pretty well. So just as you're sitting here, you could be walking, you could be in the car. Just as you are here in this moment, the invitation is to notice the air as it goes up the nose and feel it touching the inside of your nasal mucosa. And then follow the breath into your throat and into your lungs. Noticing how the chest expands as you breathe in and how it contracts as you breathe out. At all times, staying focused on the breath. And if the mind wanders, just gently bringing it back to the breath, observing it as it touches the nostrils and up the nose, into the throat and the lungs, observing the belly as it comes out with each in-breath, and then how the abdomen collapses as you breathe out. So breathing in and out, noticing the cycle of your own breath as it is. And you could pause at that, or we could take it forward. And Martha, just as you're here in this moment, breathing in and out, I invite you to focus your attention on your scalp, watching it with the eyes of your mind and feeling the sensations in the scalp, whether there's any tightness or any tingling or any feeling of warmth or cold. And as you continue to breathe in and out, bringing the breath to your temples and your forehead, watching whatever it is that you are noticing in the sensations in these areas. Sometimes there may be no sensation, and that's fine too. So just as you're here, focusing and nurturing yourself with nothing to do and nowhere to go, just taking this time for yourself. Observe how the breath flows from the scalp to the nape of your neck, watching that area at the nape of your neck where there are often knots of tension. Just letting the breath flow through that, observing the sensations there, and seeing what changes as you breathe in and out into this area. Perhaps even thanking it for keeping all the tightness there without you realizing it most of the times. Observing the sensations flowing into your shoulders, being really attentive to any feelings that are arising in the right and left shoulders. And then imagining the breath flowing into your upper arms, keeping the eyes of your mind on the sensations of the skin, or perhaps the muscles underneath, or maybe even imagining the breath flowing into the bones of your upper arms. Whatever it is that takes your attention in this moment, as you continue to breathe in and out with awareness, watching the air come in, flow into your forearms, really feeling the sensations, whether there's any tingling. What's the temperature like? How does the air feel? Watching the breath flow through the wrists into your palms, observing the sensations on the palms, on your little finger on both sides. What is the ring finger on the left hand feeling just now? And if the mind has wandered at any of these times, gently bringing it back and looking at the middle finger of both your right hand and left hand. And as you continue to be focused on your breath, just this breath, not the past one, not the future one, just this one. Imagine it flowing through the index finger and through the thumbs of your 2 hands, being totally present to the sensations that you're feeling. And as you take the breath in, letting it flow through the lungs, observing the opening of the chest, noticing how the belly goes out, observing the sensations in the abdomen, the lower back. How does your lower back feel? Is there any tightness, any tension, any sensations of delay, any tingling, or perhaps no sensation whatsoever? And bringing the breath, this current breath, to the bottom as it's sitting on a chair, feeling the contact of the chair with the legs, perhaps even noticing the touch of the fabric of your clothes on the skin. These are things that we usually remain unconscious to. So just bringing them into your consciousness, into your awareness, allowing this breath to flow through the knees into your calves. And if the mind has been taken by any thoughts, just telling the thought, yes, I note you, but I'm going back, taking my breath to my calves and my feet, watching whatever it is that is emerging without judgment. If there's any discomfort, just noticing that objectively. If there's any movement, feeling it, but not making a judgment, just accepting whatever it is that is emerging in the body. And then as you're breathing in and out, noticing how you are feeling emotionally. Is there any tightness in the chest? Is there any turmoil? Or is there a feeling of peace and calmness? Observing this moment as it is unfolding, not thinking of the past or the present, just this moment, because this is the only moment that you are the one that matters. And then, as you're observing yourself, bringing yourself out of the meditative state, and then maybe sharing with me how you're feeling.
Thank you so much. I'm already a little bit more aware of how I was feeling, because obviously during the interview, I must say I was a little bit tense. So when you refer to those muscles being a little bit tighter, they were, but just being more aware of it just helps me understand and accept why I'm feeling this way, even now. So thank you so much. That's been great. Is there anything else that you would like to add on right now, just for those first timers particularly?
So, just as I was doing the body scan, that is something I brought into my surgical practice. You know, when you're operating on the microscopes or we are using operating loops and we are bending over, we put a lot of stress on our backs. But when we are focused on the surgery, we are not thinking of our backs. And when we become uncomfortable, if it's a long procedure, then it can impact our performance. So, if we are aware of how the body is feeling, then bringing it into that state of comfort, it makes it for better surgical outcomes again. Because you're not wanting to finish the operation, you're taking it slow and steady, and you're happy to spend the time, but the body is comfortable.
Yeah, good advice. Good advice again. You're so full of knowledge. Thank you so much, Dr. Bagga. It has been amazing. Thank you so much for joining us today.
Thank you very much. It's been an absolute pleasure. Thank you.
Podplast UK is a collaboration between UK and Irish plastic surgery trainees and consultants. The content reflects individuals' practice and opinions may vary. If you have any feedback, do get in touch. We hope that this has been interesting and useful. If it has, remember to follow us for future sessions.